This video was made possible by my patrons, Joshua Bartlett, Scorch88, Drew Cavallo, James Schubach, Douglas Smith, Capitalism is Good, Pipsqueak, Michael, Valerie Calkins, Victor Cage, and Snizzy Poo. Thank you so much to all of you. Hello everyone, this is My Two Cents, and today we'll be talking about the subject of universal health care. Medicare for all, as Bernie Sanders campaigned for. I'll be taking a look at a video put out by a YouTuber called the Progressive Voice. Funny word, progressive. It sounds so positive, but that depends on exactly what you're progressing towards. Anyways, no need to jabber on about that. Let's get into it.
So here's the argument that you will sometimes hear. It is that Medicare for all is slavery. Nationalized healthcare is slavery. And you'll hear these from different people like Ben Shapiro, or I believe Ben Carson said it. But I'm here to tell you why it is clearly and obviously not slavery.
Well, when people have the fruits of their labor taken from them by force to pay for a service whether they want that service or not, what exactly would you call it?
I think that Rand Paul tried using this argument with Obamacare, and Bernie Sanders had a physician there, and the physician basically debunked what Rand Paul said.
If you'd actually provided a link to that conversation, I'd respond to it. But looking through your video description, I don't see any citations at all.
But anyway, so Medicare for all is clearly not slavery. First of all, the Medicare for all plan that Bernie Sanders had was basically just a universal Medicare card. So everybody in the country receives a Medicare card that everybody has. You can then purchase supplemental insurance through the private industry if you wanted to, but everybody gets this insurance card, and then that's then used at the hospitals.
Yeah, how many supplemental insurance providers are going to exist once there is a government-provided, quote, free healthcare system? When healthcare is privatized, insurance providers and healthcare professionals alike have every incentive to try and provide the highest quality care for the lowest possible price. That's how you make a profit in the free market. However, when there is a giant healthcare monolith provided by the government, how many people do you think are going to choose to buy additional insurance? Not many. As a result, purchasing supplemental insurance becomes insanely expensive since there is now much lower demand amongst the general population. Further, any doctors working in the private sector will either be forced to seek public employment or leave the profession as they see their number of paying patients dwindling. One only needs to look at Sweden to see an example of this.
So there's clearly nothing about that would make it slavery in any way. But when we start to talk about single-payer healthcare systems, believe it or not, all single-payer means is it's funded by the government through taxes. And because it's single-payer, it's all paid by the government.
You mean paid by the people who have their money taken from them, which the government then uses to provide a service that has no competition and can't fail regardless of how displeased the people are with the service.
There are different types of single-payer healthcare systems, and this is where it starts to get a bit confusing. So, for example, in Britain, they have the NHS, the National Health Service. So basically what they do is they actually have a nationalized healthcare where the government pays for it and it's run by the government. And they actually have a really good healthcare system with wait times that are even less than the United States.
Really? They do? Do you have a citation? Doesn't appear so. But hey, let's suppose for a minute that the British NHS really does have better wait times than in the US. Never mind that the NHS is bankrupting the UK and forcing hospitals to cut costs at the expense of their patients. Never mind that patients who undergo major surgeries are 4 times more likely to die than in the US. Never mind that 750 avoidable deaths occur every month in NHS hospitals. Never mind that tens of thousands wait an average of 18 weeks for routine surgery. And yet, the left still believes that the NHS is the crown jewel of all healthcare. Well, there was one study conducted by the Commonwealth Fund that supposedly showed that the British NHS is the best in the world. However, as the Mises Institute noted in reference to this study, how is it possible then that the NHS should have ranked so highly in this recent study by the influential Commonwealth Fund Health think tank, despite all these major problems? The answer is in the study's careful selection of the criteria used as metrics of success, in order to give the most weight to the few areas in which the NHS actually does succeed. Indeed, the study stands out considerably from all other healthcare system comparisons by the great weight it places on procedure and general system characteristics, with relatively little weight given to the actual outcomes. One might think that the NHS's place in the bottom 20% for both cancer survival rates and medically avoidable death rates would be seen as a statistic too important to be swept under the rug by the technicalities of this study's method. The Commonwealth Fund also gives surprisingly little weight to the NHS's dismally low efficiency in terms of healthcare bang per buck, a fact which undermines those who claim that simply throwing more taxpayers' money at the system would solve its problems. So, yeah, the NHS is so much better than healthcare in the US.
Canada, on the other hand, they actually have a system where most of the all of the funding, of course, comes from the government, but most of the Canadian healthcare services are delivered from the private sector. So here's a quote that says, "The Canadian system is for the most part publicly funded, yet most of the services are provided by private enterprises. Most doctors do not receive an annual salary, but receive a fee per visit or service." According to Dr. Albert Schumacher, former president of the Canadian Medical Association, an estimated 75% of Canadian healthcare services are delivered privately, but funded publicly.
Yes, and the Canadian system creates a phenomenon called third-party buying. Allow me to explain. When you spend your own money on a product you want, you're careful to balance quality and quantity. You might want that giant TV that covers the whole wall, but when you consider the cost compared to the fact that a 24-inch TV will play the same shows, it probably doesn't seem quite so appealing. This is first-party buying. You're spending your own money on something you will use. However, imagine your grandmother sends you to the store with promises that she'll buy you whatever TV you want, regardless of cost. In this case, all you care about is quality, not price, since you're not the one paying. Who's going to pick the useful but cheaper option if someone else is paying? This is third-party buying. Your grandmother is paying for something that she won't use, and you're making the decision about what gets bought. Canadian doctors aren't stupid. Since they can't set their own prices or rely on competition, they have every incentive to prescribe medical services that may or may not actually be necessary, since they know the person buying isn't actually the one paying, and therefore won't actually consider whether or not they really need the services that the doctor is prescribing. Not to mention that Canada also suffers from the same inefficiency present in all other forms of socialized medicine.
So they're funded publicly, but they're delivered through the private sector. This is not by any means slavery, because it is just like any other job. Anything else that is provided as a right through the government, even though this wouldn't be providing it as a right, similar to how the Sixth Amendment grants a right to counsel, and that means that you have a right to a lawyer in a criminal case, doesn't mean that the lawyers are then slaves.
Well, if you care at all about your representation, you'll pay for your own lawyer. Anyone involved in the criminal justice system will tell you that your court-appointed attorney isn't likely to try very hard to help you. He's getting paid no matter what.
It's just like any other job. If you want to be a physician or whatever person, and you want to work in healthcare industry, you can decide to work there, and if you do, it's just working like any other job. You can quit if you want to. You don't have to work anymore. No one's going to force you to work. Again, it's just like any other job, and I think that this argument is utterly laughable and just honestly massively stupid.
Well, allow me to explain the difference to you then. In a free market, doctors and other healthcare workers are accountable to their patients. If the patient isn't satisfied with the service they receive, they'll go somewhere else, and said healthcare workers will lose profits. However, when healthcare is provided by government and the worker's salary is paid with taxes, the workers know they'll still be paid no matter how displeased the patients are with the services they receive. Where then is there any incentive to innovate and improve conditions for patients? Very few people will choose to go above and beyond when they know it won't increase their profits even slightly. Here's the bottom line for healthcare. You can jabber all day about how healthcare is a right. That doesn't change the fact that there are a limited number of physicians, healthcare workers, and medical supplies that have to be rationed one way or another. Prices in a free market will ensure efficient allocation due to the laws of supply and demand. Competition amongst private healthcare providers will also bring the incentive to provide the highest quality care for the lowest possible price. Universal healthcare, on the other hand, like all other socialized programs, sooner or later drowns in inefficiency. It's been said that the goal of healthcare is for it to be high quality, affordable, and universal. The problem is, it's impossible to achieve all three of these at once. If you choose universal and affordable, it gets you low quality healthcare, which is no help to anyone. If you choose universal and high quality, you will bankrupt the system and lead to doctors being forced to cut costs at harm to their own patients. High quality and affordable under a free market turns out to be the best option, since it makes it possible for the greatest number of people to receive high quality healthcare. And that is my 2 cents. Take it for what it's worth. Thanks everyone for watching. If you liked this video, please hit like and subscribe. You can also hit the bell to ensure you're notified every time I upload a new video. This video was made possible by my patrons. If anyone else would like to donate and help ensure that I have the time and resources to keep putting out content, for just $1 a month on Patreon or Maker Support, you'll receive a shout out at the beginning and end of every video, and the link to one of your social media platforms in the description. You can also support the channel by purchasing my 2 cents merchandise on Teespring or from my Amazon affiliate links. To follow me on Twitter, minds.com, BitChute, WordPress, Gab, or iTunes, check out the links in the description. Uploads are every Tuesday, Thursday, and Saturday, so stay tuned for more videos.